只要2到3公分这个口子，把胶水灌进去，那么就可以让这个骨头实现固定，伤筋动骨躺100天。我们想改变这样的一个骨折治疗的模式，我们用胶水给它粘上去，3到5分钟就可以实现很高强度的这种粘合。胶水会慢慢自己降解、消化、吸收，不需要再开第2刀把胶水取出来。未来我们希望一个骨折的病人在门诊当中给他打1针，他的骨头就能够粘合好。
More than 3 months ago, a worker in Hangzhou, Mr. Wang, broke his wrist badly from an accident. The usual way to fix this is with a big cut and putting in a metal plate and screws. This is not only a large wound, but it also has risks like damaging muscles or nerves. Plus, you need a second surgery a year later to take the metal out. By using bone glue, our team only needed to make a small cut of 2-3 centimeters to inject the glue material. In just 3 minutes, the shattered bone pieces were precisely glued and held in place. A follow-up 3 months after the surgery showed that the patient's fracture healed well. He had no problems, and his wrist could move perfectly again. On the morning of September 9th, Professor Fen Shunwu, the head of orthopedics at Sir Run Run Shaw Hospital of Zhejiang University School of Medicine, shared this exciting case at a press conference for the world's first bone glue, a major homegrown invention. The idea for bone glue came from an old story about using oysters to fix a bridge's foundation. In ancient China, bridge builders in Quanzhou, a coastal city in China, had a problem. The piers of the Luoyang Bridge, which crossed the sea, were being worn away by the seawater. Instead of fighting against the ocean, they used a trick from nature. They raised oysters under the bridge. The natural glue that these amazing creatures release made the bridge piers so strong that they have stood for 1,000 years against the tides. This became the world's earliest marvel of bioengineering. Inspired by the secret of how oysters stick to things, a team led by Professor Fan Shunwu and Dr. Lin Jianfeng from the orthopedics department at Sir Run Run Shaw Hospital solved a medical problem that has existed for a century. They successfully created the world's first bone glue material that can stick strongly and immediately inside the human body's bloody environment. In September 2025, after 8 months of research, Sir Run Run Shaw Hospital, along with other top hospitals in China, finished signing up patients for the world's first major clinical study on using this glue for shattered fractures. The bone glue was shown to be safe and effective in more than 150 patients, with all results meeting the targets. This new material can be used to glue together large and small broken bone pieces. It is expected to reduce or even replace the use of traditional metal implants, bringing a revolutionary change to how broken bones are treated. A broken bone is a common injury. If not treated well and quickly, it can lead to serious problems. It is one of the main reasons for disability in young and middle-aged patients and death in older patients. With modern medicine, especially with metal implants like screws and plates, the outcome for broken bones has improved a lot. But for shattered fractures with many small, broken pieces, treatment is still a huge challenge. It's hard for doctors to put the small pieces back in their exact original positions using metal plates. Trying to fix these small pieces takes a lot of time and effort, and it's difficult to piece them together perfectly. The small bone fragments can also get lost or absorbed during the operation, causing a permanent loss of bone, which can lead to the fracture healing slowly or not at all. This is especially true for shattered fractures near a joint. If the pieces aren't put back perfectly, the joint surface can become uneven, leading to arthritis later on and seriously affecting the patient's ability to move and their quality of life. A broken mirror can be made whole again, but can shattered bones be glued back like new? Around the world, there are tens of millions of new cases of shattered fractures every year. Finding a better, less invasive way to treat these patients has become one of the biggest challenges in orthopedics. If only there was a medical material that could directly glue bones together. This simple idea had been in Professor Fan Shunwu's mind since he first became a doctor over 40 years ago. In fact, for more than a century, scientists and doctors all over the world have been searching for a material to quickly glue bone tissue, but they could never solve two big problems: making it safe for the body and making it stick well in a bloody environment. Professor Fan passed this challenge on to Dr. Lin Jianfeng, who is in his early 30s. Back in 2016, when Dr. Lin was still a junior doctor, he saw firsthand how difficult and frustrating it was to treat shattered fractures. He noticed that even very experienced senior doctors would spend hours in surgery trying to fix tiny bone fragments, and the results were often not perfect. With his own experience and research, Dr. Lin decided to lead a young team to develop a bone glue. However, for the first few years, they didn't make much real progress, and the research came to a halt. The turning point came when Dr. Lin went home to visit his family in Wenzhou. Having grown up by the sea, he happened to notice a thick layer of oysters stuck to the bottom of a sea-crossing bridge. They were held on tightly to the concrete, even after being hit by strong winds and waves for years. This scene from nature gave him an idea in an instant. If oysters can stick so firmly in seawater, could they create something similar that works in the wet environment of the human body? Inspired by this idea from nature, the team had a clear direction. But turning an idea into a product meant overcoming many challenges. First, they had to find the right material that could form a strong bond quickly in blood, be safe for the body, and control its temperature to avoid burning tissue. Second, they had to create a standard, repeatable process to make the material so that it was easy to use in surgery. Finally, they had to prove through strict testing that it was safe and would be absorbed by the body over time. By studying how oysters stick to things, and after trying more than 50 different formulas and hundreds of tests on animals like rats, rabbits, and dogs, the team finally solved the key problems of safety, stickiness in blood, and ease of use in surgery. The research made 3 main breakthroughs. It creates a strong bond in -3 minutes, even in a wet and bloody environment. It is simple and fast to use, making surgery much quicker. The material is fully biodegradable. It gets naturally absorbed by the body in about 6 months as the bone heals, leaving no trace behind. This saves patients from needing a second surgery to remove implants. The team gave this smart invention a fun name, bone glue. The name was inspired by the famous 502 super glue, hoping it would become just as strong and widely used in the field of bone surgery. Tests showed that the bone glue can hold a pull of over 200 kilograms, about 440 pounds, showing it has the potential to replace metal implants. It also lowers the risks of infection and reactions to metal inside the body, makes surgery much faster, and causes less harm, making bone surgery truly minimally invasive. The value of bone glue has already been proven in the 150 patients in the clinical trial, including Mr. Wang from the beginning of the story. In the future, it might be possible to heal a broken bone with just an injection, Dr. Lin mentioned. Its wide range of potential uses is especially worth mentioning, said Dr. Lin. It can be used to fix fractures of all sizes in almost any part of the body, especially for tiny fragments that are hard to fix with traditional tools. Because it sticks quickly and is easy to use, it could one day be used for emergency treatment of fractures in special situations like on the battlefield or in disaster rescue. This technology, originally created by Chinese doctors, marks a major homegrown breakthrough for China in the field of minimally invasive fracture treatment. Currently, the core research team for bone glue has applied for a Chinese invention patent and also filed an international PCT patent. It has been confirmed by experts to be new and creative. While bone glue has shown exciting promise for treating shattered fractures, the research team is already looking at a wider range of uses. The next step is to start clinical trials for using it in dental implants and minimally invasive spine surgery. As its uses expand, bone glue is moving from a single solution to changing the entire system of treatment. The key to clinical breakthroughs is to think outside the box, said Professor Fan Shunwu. Oysters fixing bones, spinach providing energy. The scientific realization of these seemingly wild ideas is a reflection of Chinese scientists aiming for the world's technological frontiers, sparking innovation, and breaking through key core technologies. Kai Shujun, the president of Sir Run Run Shaw Hospital, congratulated Professor Fan's team on the successful development of the landmark bone glue. He said that the project started by looking at a real need and a difficult problem for patients. It solved a worldwide challenge through teamwork between different fields, showing the hospital's focus on innovation and problem solving. It is a model of how education, science, and talent can work together in a firm practice of the four-oriented strategy. He stated that the hospital will continue to support the clinical trials and promotion of this new technology, helping this made-in-China innovation benefit patients around the world as soon as possible and contribute to human health.